Hello all. The fifth and sixth sections will focus on the practices of public health. In 1920, renowned public health expert Winslow defined public health as the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. This definition highlights a proactive approach to health, one that goes beyond merely addressing illness. It emphasizes our collective responsibility to foster a positive state of health and well-being. As we delve deeper into the concept of health, it becomes apparent that it is more than merely the absence of disease. The World Health Organization offers a more comprehensive perspective, defining health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Further expanding on this, the Association of Teachers of Preventive Medicine provides a nuanced definition. Health is a state characterized by anatomical, physiological, and psychological integrity, the ability to perform personally valued family, work, and community roles, the capacity to handle physical, biological, psychological, and social stress, a feeling of well-being, and freedom from the risk of disease and untimely death. This view highlights the multifaceted nature of health, integrating not just physical aspects but also our ability to function effectively in various roles and our overall sense of well-being. The Ottawa Charter takes this a step further by defining health as a resource of everyday life, not the objective of living. It emphasizes that health is a positive concept reflecting our social and personal resources as well as our physical capacities. This perspective challenges us to see health as an enabler for a fulfilling life rather than a mere goal to be achieved. The CDC's Health Impact Pyramid illustrates the varying impacts of different public health interventions, with the most significant effects stemming from addressing socioeconomic factors. As depicted in the pyramid, these factors encompassing elements such as income, education, and employment from the foundation for improving overall health. By focusing on these social determinants, we address the root causes of health disparities and create a broad and lasting impact, surpassing the effectiveness of other interventions higher up the pyramid. Understanding and acting upon these socioeconomic determinants is essential for fostering equitable health outcomes and building resilient communities. Let's briefly discuss the social determinants of health. Social determinants of health are the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risk. Among the various frameworks for understanding these factors, the World Health Organization framework is particularly comprehensive, encompassing both structural and intermediate determinants. Structural determinants involve overarching factors such as socioeconomic and political context, while intermediate determinants include more specific elements like living conditions and access to health services. By addressing these determinants, we can work towards reducing health inequities and improving the well-being of populations globally. In the public health approach, we focus on crafting preventive strategies by examining risk and protective factors that influence health outcomes. These factors can often be traced to both structural and intermediate determinants. The approach is methodical, consisting of 4 crucial steps. First, we define the problem to understand the scope of nature of the health issue. Next, we identify the risk and protective factors that contribute to mitigate the problem. Based on this understanding, we develop and test preventive strategies tailored to address these factors effectively. Finally, we aim to ensure the widespread adoption of these strategies to maximize their impact and improve public health outcomes. By systematically addressing these steps, we can create more targeted and effective intervention that promote healthier communities and reduce disparities. Thank you. See you in the next section on core function, essential health services, and public health core sciences.